I'm gonna
Just 15. Okay.
I'm just on
Right. Hi, everybody online, everybody in the room. Welcome to the noon meeting. It's very nice to see you all. I thought being a short week that maybe we wouldn't have anybody here and that Amnesty and I would be able to go and have coffee. But it looks like
You guys ruined that plan.
It ruined that plan. So So we apologies to those online. I'm afraid we planned to have a video, but somebody's painted over the end of the video cable. So
It was not me. It was not me.
before us. So you won't be able to see Amnesty, I'm afraid. But there are some slides, and yeah, hopefully you can hear our voices. So just in the spirit of introduction, my name is Jill LeFevre. I'm the current head of the Health Policy Assistance Division, and it's our turn to support the school public health's maybe I haven't had my coffee. The noon meeting. Amnesty has newly joined the Health Policy Assistance Division, although she's not new to the school. She's been here for some time already. So we're very excited to have Amnesty representing the division. And I'm going to leave it to you, Amnesty, to tell us, everybody, a little bit more about yourself as well.
Okay.
As well as what you're going to be speaking to. And I'm going to run and manage things.
Yes. Thanks, guys, for joining online. We unfortunately won't have time to do introductions to all folks online. I do tend to move. So if you can't hear, just Jill's monitoring the online, system. So I'll come back to the monitor. And so feel free. We want to sort of keep this informal. If you have questions, please use the chat, unmic yourself, just come in and jump in at any stage. I hope everyone can see. Can you just give a thumbs up if you can see the slides on the screen if you're online? Fantastic. Okay, fantastic. Thanks. So I've been asked to speak about some of the work that we're doing on optimizing measurement of AI readiness and digital competency for frontline health workers. I'm going to start the talk with just a sort of a brief introduction of our larger team and the people behind this work, and I'll close the talk with just a snapshot of some of the work that our colleagues are leading, just so you have a sense of what the broader team's engaged in and can follow up with myself or other colleagues as interests align. And Jill, I'm going to ask you to just keep tabs on time. Okay, fantastic. So I'm a little bit wedded, unfortunately, to the computer because we don't have a working remote. But just to sort of acknowledge that the work we're going to talk a little bit about today has been funded by a range of actors, including the Gates Foundation and World Bank, and was made possible only with the support of a whole network of research partners. I won't go through all of them, but it's important to note I'm just sort of one voice in a chorus of many. Among our core sort of faculty leadership, again, I won't go through names, except just to sort of acknowledge that we have collaborators also from other universities at Johns Hopkins, York University, et cetera. And then just here in the room is Dr. Jill Oliver. She introduced herself already, and online, Dr. Osama Umar, who really helms a lot of this work. Again, towards the end of the talk, I'm going to really sort of hopefully signpost a lot of work that our colleagues here at UCT are engaged in. This large quorum of digital health fellows has really been instrumental in driving a number of different reviews and other pieces of work. So again, we'll signpost that towards the end of the program, and I hope you'll feel free to reach out to them for further details. Okay, so just who are we? So we sort of self-named ourselves as sort of evidence for digital transformation consortium. And we work really across kind of three different areas. The first is really in supporting the development of global guidelines for digital innovations. The second is innovations in measurement, and the third is commissioned research. So just to kind of give you a sense of some of our portfolio of work, we've been for over a decade now supporting the development of different global guidelines, starting with the 2016 WHO guidelines on how to do monitoring and evaluation of digital innovations. That's since spawned quite a number of different measurement guidance. Most recently, you're going to have to stand closer. Okay. Most recently, measurement of digital access and use, including digital competency. So if you go on our website, which is linked up, you'll see lots of different toolkits and briefers and so on that really have sought to speak towards a body of work I'll mention about harmonizing how we measure key concepts. This has been done sort of both for the health workforce and at a population level with different funders and stakeholders involved. The other place we work a lot in is innovations in measurement. So that's including sort of cognitive testing to improve how we measure and develop survey questions. This most recently has led to a lot of work with the ITU on their digital skills indicator to try and improve how that's used across 190 member states, and feeds into the SDG on digital skills, which is SDG 4. And then we've also done a lot of work using AI to enhance the quality of survey data, done a lot of work on remote phone surveys and different ways of measurement. And then most recently also looking at how we measure women's access to and use of technology as part of sort of digital inclusion work. And then I'll sort of talk a little bit at the end about ongoing work related to harms measurement, particularly around technology use for health workers. Commissioned research, again, I won't go too much into this. We do a lot on both reviews and then primary research across a range of settings, both in terms of like health systems wide support to state governments, and then evaluations of standalone digital programs at scale. And you can see here just different special supplements we've been involved in. If you're interested, you can sort of queue in. We've done 2 special supplements with BMJ, one on digital innovations for community and primary healthcare. Osama might be able to pop the link in the chat. And then we have a forthcoming one in JMIR on digital inclusion. I want to just sort of focus then on to within that sort of larger scope of work on digital competency measurement. So I want to talk about it in 3 basic parts. The first is I'm going to set the stage, and I want to talk about why digital skills matter for frontline health workers very briefly. And then I want to talk about actually how are we thinking about measurement? And to get through to frontline health workers, I first have to talk about it at a population level. Recognizing that a lot of frontline health workers are women. They tend to be lower literate and have lesser levels of training than, higher levels of cadres. And then I'm going to talk about some of our ongoing work. Okay, so in this sort of first part, I want to start with just some of the work that Dr. Chimwe and Naomi have been involved in. I think Naomi's online, but Chimwe has a conflict. So I'm just going to sort of give a brief overview of some of the sort of background of what we know to date about the digitalization of CHW programs. So the Gates Foundation, to sort of inform their primary healthcare strategy, asked us to basically say, what are the things they need to think about if they're going to invest in health systems efforts to introduce digital solutions, particularly around frontline health worker cadres. So we drew from a larger systematic review that looked at over 4,000 different examples of community health worker programs and had done a quality screening of those programs. And from that, we had a subset of 12 high quality studies where CHWs had been digitally enabled. And then we dove using sort of narrative review methods of sort of pulling all the literature we could find, and then in doing qualitative interviews with individuals involved in that analysis, we sought to look at the drivers of impact for those particular studies. So I'm not going to go too much into detail in that. If you're interested, again, there's sort of more details on our website. But just to give a snapshot of where these studies were, they were sort of equally divided between Africa and Asia, predominantly in India, with a couple of sites in sub-Saharan Africa also. But we sort of, for those of you that are in the health systems program, there's lots of different ways to think about how frontline health workers are using digital solutions. I would argue that one of the limitations of systematic reviews for digital solutions has been that they haven't really looked at the health systems factors and the broader infrastructure upon which digital solutions are introduced. They kind of just sort of broadly throw everything into the soup. And from a sort of randomized controlled trial perspective, did your intervention arm with all this stuff happening yield an impact as compared to this control area where there wasn't a digital solution? So because of that, sort of really trying to understand what factors drove impact can be really challenging. So we sought to really tease out both the sort of health systems context and the sort of program features. So we define that very simply in terms of including facility-based services and community-based services, looking from a program side at both the broader intervention activities that were introduced and then the digital component of the program. So really kind of breaking out, the blueprint of the program. And then of course, looking at different cross-cutting factors ranging from connectivity to sort of social and gender norms. and then looking at the impact of these on a range of outcomes from service delivery, care seeking to health outcomes. And again, I want to get to digital competency, but really we've started to see from this piece of ongoing work that, not surprisingly, synthesizing evidence remains challenging for digital health programs. Years ago, as part of the WHO's effort to sort of convene, evidence on health systems interventions and what we know about the impact of digital solutions, they issued guidelines, and they followed the sort of typical Cochrane review process. And very, very few studies met that rigorous evidence threshold needed to even be considered. And so in the end, we were voting on what we sort of thought as opposed to what the evidence actually supported, just because there simply wasn't evidence. So a decade later, I don't think we've cracked that nut. In fact, I think there's less investment in evidence generation, and there's more pressure to generate it quickly. But that said, what we have sort of started to see from these programs is that we need to have different alternative ways of evaluating that can speak to the need for rapid innovation and rapid change, but also can address the need for evidence to support informed decision making. So from this work, just sort of briefly on what do we know about the introduction of digital tools for frontline health workers? Not surprisingly, we see that CHW cadres are highly heterogeneous. Different levels of remuneration, different levels of literacy, training, et cetera. The digital health interventions that are introduced vary widely. And in our particular case, because we had a 10-year time horizon, often the solutions we're looking at are completely obsolete in today's environment. So it's really hard to kind of draw meaning from that. And then from an evaluation, study designs aren't always designed in such a way that we can actually tease out impact, which makes our underlying premise quite challenging. That said, we do quite clearly see a story around impact, not surprisingly being bolstered when there's value to the health worker. So the full scope of work has to be digitized. There needs to be bi-directional flow of data, workflow planning, decision support, algorithms, and, again, tailored counseling messages. And within all of this, when we look at the performance of health workers using digital solutions, we see that the leading impediment is often lack of digital skills. And that goes closely with the solutions not always being designed to work for them in a way that they want. Like if I introduce or I give you an app, you'll figure out how to use it if you really like it, right? Like you don't need somebody necessarily to train you to do it. So I think it sort of goes hand in hand. If you have a solution people really like, they'll figure out how to use it, or they'll, learn from their colleagues or children, et cetera. But if it's really just something for administratively entering data, not useful to my service delivery, I'm probably not going to use it. And then my digital skills don't get bolstered if you test me on how to use it. So it's a little bit like horse before the cart when we think about this. But that said, digital upskilling in digital programs is a key piece to this puzzle of how do we improve how technology is used in the health sector. So this brings me to this next point of what do we mean when we say digital competency? So without looking at the slide, what would most of you say, digital literacy or digital competency? What's the difference? Anyone? Okay, come on, Anson, you gotta help.
Okay, so basically, I'm sort of looked at the slide, but basically, digital literacy is more of the knowledge and understanding of digital technologies.
Yeah.
And then competency is now patience and skills.
Yeah, very good. So the origins of the words are kind of interesting. So there's been a European researcher who sort of looked at both the origins of the words digital competency and digital literacy and the frequency of use across geographies. And the snapshot of that work is that they've often been misused, the terms, and often used interchangeably. Americans have tended to butcher, and a lot of our literature uses the term digital literacy when we actually probably mean digital competency, whereas Europeans have more consistently used the term digital competency. But nevertheless, we've sort of come to this, sort of middle ground where we define digital literacy as sort of a extension of what we used to call computer literacy. And that really does focus exactly, as you said, on knowledge and understanding, whereas digital competency denotes an element of application. So it's both sort of applying the digital skills in real life. And, again, you'll see sort of different definitions depending on the stakeholders, and you'll see different guidelines. But I think at the end of the day, the field has moved more in the direction of recognizing that digital competency is what we want to be measuring and talking about. From a practical standpoint, that includes 3 bins of things: knowledge, so the theoretical practice or understanding of things; skills, which I think we're all cool on; and then attitudes. So when we talk about measurement, to date, most people tend to focus on skills, including us. You have limited real estate. I might be able to get you to do a 45-minute survey. And if I am going to get you to do 45 minutes of a survey and I'm going to try and assess your digital skills, getting knowledge questions and attitude questions are often seen as lower priority because there is this sort of no-do gap. So, there tends to be a sort of inherent focus really on the skills piece. So for the slides to come, you'll see a lot of our measurement work is really honed in on skills, just from sort of a strength in terms of priority. Attitudes increasingly comes into play as also being something important. The challenge from a measurement perspective is that we focus on usually measuring those as part of a Likert scale. And so we've done a lot of work looking at comprehension of Likert scales, particularly those denoting agreement. 5 if you strongly agree, 0 if you don't agree, with some neutral element in there. And what we see is that in low literate populations, they're not able to handle Likert scales above a 3-point scale. So measuring attitudes becomes quite challenging in a binary fashion or with lesser scales. So anyway, we've for that and other reasons have tended to kind of hone in on digital skills. And so digital competency is often then synonymous with digital skills, at least at this point. So let's talk about how actually we go about measuring it. So WHO has defined sort of 4 key audiences for digital competency frameworks. Starting at the base of this pyramid, they would talk about population, people, patients, practitioners, providers, going up, planners, researchers, developers, policy decision makers at the top. Our colleagues at the World Bank have done work at the top of this pyramid, and then we've supported efforts at the bottom. So I'm just going to speak at the bottom 2 slices in the next 15 minutes. Okay, so starting with population. So this is probably the most well-studied space. And so it's a good foundational point to kind of learn from when we think about measurement for frontline health workers. The most recognized framework used globally is one developed by the European Commission. And that's called the DigComp, or Digital Competence Framework. It's now in its 3rd iteration, with the most recent iteration having come out in December of last year, which is the dark blue on the screen. What I like about DigComp is that it provides us sort of a very practical 5 set of competence areas, and then within each of those different domains. I'm not going to get into the weeds of this, but you'll see the use of color throughout, which links back to relevant competence areas in this figure. And with help from the ITU, this sort of DigComp framework has been used then as the basis for population level measurement of digital skills. There's lots of issues with it. I'm not saying it's perfect, but at least it gives some sort of nomenclature of talking about things in a common language. The ITU has within these identified a set of 20 different parameters to measure. We developed the questions for their most recent iteration after cognitive testing and working with them. And to measure these requires almost 30 questions. So if you think from a practical standpoint in a survey, you're going to have 30 questions. You spend a minute a question at least. It gets quite intensive to measure this. So the ITU tries to solicit data from 194 member states once a year, at least on this indicator. And not surprisingly, there's lots of bias in who's actually able to report this out. UNICEF's mixed survey was the source for South Africa in most LMIC countries. They included 12 questions, not the full indicator, but they included 12 different digital skills questions as part of the mixed survey. And that then was the foundation for most SDG measurement on digital skills historically. We did a lot of analysis of those data, about mentioning it here, but found a lot of challenges with how those questions were worded and their comprehension. So we've been working with UNICEF to kind of give recommendations on how to revise that, but it's to change questions in global surveys, which was a big focus of one of our investments from the Gates Foundation, is very, very difficult. Mostly because they don't want to lose longitudinal comparisons. And then the politics around moving a single indicator is quite intensive. But that said, you know, there were lots of problems with the phrasing and use of different parameters. The biggest one was that there historically has been a focus on computer skills, which for most low and middle income countries, how are we using? We're all now on, you know, basically a handheld computer. We're on a smartphone, right? So the majority of the population accesses, you know, digital solutions through a mobile phone. And the way, at least up until Mix 7, the way that they captured digital skills was only on computer users. So it was like less than 10% of the sample would be administered the module on digital skills. That has changed in the latest round, but nevertheless, data in terms of visibility of what we have for LMICs is very restricted to that population of computer users, which you can imagine. They're people that are high socioeconomic status, they have maybe an office job. It skews the data and the visibility of what we have about skills. The second challenge is that there really isn't a consensus on which skills to prioritize within the competency domains. So there has been this move towards a competency approach, yet there's also not complete agreement on which competency domains you should have. Like the ones I showed from DigComp, UNESCO's added 2 to them. We added an additional one. WHO's framework, which is yet to be published, but meant to come out this year, probably has a dozen, I'm anticipating. And so I would make the case it's probably not measurable once you get past a certain number. Just think to measure each competency domain, you need at least 2-3 questions. It starts to spiral quite quickly. And then, you know, we see varied approaches to how you actually administer surveys. So there's not one core set of survey questions. The surveys could be administered in a different way through observation, self-assessment, and then how you analyze it and how you calculate levels of digital skills vary. So just again, sort of signposting this, we don't have a lot of time, but we've been engaged in a sort of 3-year effort to improve how we harmonize measurement of digital competency. Originally, that was conceived of just sort of as part of population-based surveys, and it's since moved to frontline health workers. I'm just going to focus on this sort of box on the primary data collection work that we've done in India, Kenya, Nigeria, and in particular, some of the large-scale population-based surveys from Bihar. Just to note that this was preceded by a whole effort of expert consultations, reviews, and so on. Just as part of that, I'll just signpost some of the work on cognitive testing that was done in India, Kenya, Nigeria. How many of you know what cognitive testing is? None. Okay, that's cool. Anyone else? No? Let me just tell you. Okay, fantastic. So cognitive testing basically is concerned with this idea that you don't want a disconnect between how I understand a survey question as the person administering the survey and how you understand it as the person answering it. So if I read you a question that says, let me just think of I'm trying to think of a good example. Osama can also come in here and bail me out. But if I think of a question like, do you own a mobile phone? And I mean, we have a conversation about that. How you respond and what you think of a phone owner is probably pretty similar, right? Like we're a similar demographic. You know, you're a graduate student, you probably have your own phone, you know, like you think that I bought it maybe, I have access to it and use it, you know, I have sole access and use throughout the day. So it might, in your mind, might have ownership, might have connotations of both sort of my physical access to the device, maybe my purchasing of the device. But either way, probably we both understand that question in the same way, right? So if I instead ask somebody in India, where half of women have no access to a phone, their understanding is maybe a little bit different. For example, maybe their access, they have one phone in the household and it's really the husband's phone. He takes it with him when he goes out for work in the day and he comes back. So the woman's access is mediated through the husband and based on his physical presence in the household. So if I then administer a survey to that woman and I say, do you own a phone? In some cases, she may in her mind think, yeah, I have access to a phone. Yeah, when my husband comes home, I use it. So she may respond, yes. when, again, it's a difference in understanding perhaps of ownership that could vary. Another woman in the same household may say, well, no, that's not my phone. That's Innocent's phone, Yes, he lets me use it, but that's his property. So what cognitive testing basically does is it allows us to phrase questions in a way that tries to limit differences in interpretation, which could lead to challenges in the data. So it's a very sort of robust, and we need a separate talk on this. I wish Carrie was here, but so no, yeah, I can point you guys to papers on this, but it's in essence an incredibly intensive process where you take a subsample of questions. So we had, how many, Osama can come off mute, but I think we had 180 questions that were deemed priorities across domains of digital access and use, including about 35 different digital skills questions. And what you do is you administer, using qualitative interviews, I administer the quantitative survey question to you just like I would normally. Read the survey question, hey, do you own a phone? And you respond as you would normally, yes or no, in a binary fashion, depending on how the question is phrased. And then I'm like, okay, well, when I asked you about phone ownership, like, what were you thinking? Like, why did you say what you say? And we proceed to then have an intensive conversation about what actually did you understand the question to mean, and how did that align with my intention for the question? So in some respects, if I'm talking about apples, and actually you were thinking about oranges, cognitive testing would pick that up and would now allow us to change the phrasing of the question through an iterative process to gradually get us to a place where we're talking apples to apples. Does that make sense? Yeah, go ahead.
With these questions, you're talking in the person's first language.
Yes. Yes. So the other place, it can be the content of phrasing of words and then the translation. So it fixes both, but it's a very costly, right. And so what even, non-digital domains, we were cognitive testing questions around exclusive breastfeeding. And in India, you really just see historically those data are very problematic because of the phrasing. It's a very Eurocentric, high Hindi speaking, educated person's way of phrasing. For example, if I say exclusive breastfeeding, probably we all understand that to mean nothing but milk, right? Nothing but milk. In India, you'd have to add clauses of nothing but milk and also nothing, no water, no jamanguti, no other things, because it wouldn't occur to people. It's not that they're lying to you. It's just that they don't think that if I give my child, some sips of water or some jamanguti, some local other things, that counts. So yeah, Rebecca, go ahead.
I think you have the exact same response in like a clinic in South Africa as well, even if you translated it.
Absolutely.
Language, you also need to include those caveats.
So we did a lot of cognitive testing work around consent for onward health data use here. And South Africa presents its own added complexities because of the intermingling of languages. So it's not like I can just have a single script in Xhosa. I have to interweave in different words because people are mixing languages. So it gets a whole other level of complexity, at least here. But I think the premise to take away, this needs to be a separate discussion, but the premise that we came away with was we were able to take all of the ITU's questions and UNICEF's questions and cognitive test them. And we had done secondary analysis on those data, looking at across socio-demographic characteristics and geographies on how people reported their digital skills. And what you very clearly saw, you saw over-reporting of certain skills amongst populations where there's no way that they did that. Like, for example, in Nigeria, we saw that within the lowest socioeconomic quintile, so your poorest people, had a high reporting of computer programming. And the question was phrased, in the last 3 months, have you ever done computer programming? And for me, right away, I'm like, what do you mean by computer programming? I start to be like, do you mean use of, we have lots of questions, right? But the question obviously was phrased quite badly, like, in the last 3 months, have you done any computer programming? When we did cognitive testing around it, not surprisingly, people are like, what, I don't know what that means. Or they were thinking something differently if they respond in the affirmative. When you look at data at scale, you saw that within the lowest socioeconomic quintile, there was a higher level of reporting of that skill than people in the highest, which would again suggest that there's an inconsistency in the data that may be attributed to how people understood the question. So long story short, we were able to tweak how you phrase questions to try and improve that cognitive alignment. So then next step, let's go to the field and test that quantitative survey tool. Let's figure out where there are places where the cognitive testing hasn't answered questions perfectly for us. Let's do A/B testing. And this also presents an opportunity to also do observed digital skills versus like what you tell me you can do. So we can try different ways of measuring things. I'm not getting so much into the results of all of that because I'm sidetracked a bit anyway, haven't got to health workers yet. But what this allowed us to do across the Indian state of Bihar, we were able to focus across the state in 10 districts. This, for those of you that don't know, Bihar is the second most populous state in India. It's consistently ranked within the lowest performance indicators for most parameters, including the Human Development Index, where it's ranked the lowest. The Gates Foundation has probably spent $100 million there in different development programs over the last decade. So it's one of several priority states for them. And then our particular angle was to work with the state government entity that supports women's economic empowerment groups. So we did a statewide survey across men and across women, but then a sub-objective was to specifically tease out whether these economic empowerment groups were catalysts for improving women's access to and use of technology. This was a large survey. We went to almost 70,000 households, interviewed about 13,500 people. Again, longer survey, and our objective here is to test different ways of measuring things, but also get a sense of primary data. So I've just highlighted how we were thinking about this concept of digital access, which for us included dimensions of connectivity, physical access, and affordability, and then use, which includes, these should look familiar, all the digital competency domains from DigComp. And then we also looked at issues around safety, security, social norms, digital agency, and what you're using the phone for, which we called sort of relevance. Again, I don't have time to get into all of the results from this, so I'm not. I just want to mention this digital access and use index, which we derived through two different ways. One was through an empirical data-driven strategy, and one was getting expert consensus. And the reason I'm mentioning this is because this includes, digital skills. Over half of the final tranche of questions is on digital skills. So the hope is that this gives better visibility into the experience of digital access and use, one driver of which would be skills at a population level, and becomes a different way of, a more nuanced way of thinking about digital inclusion, particularly for women in Southeast Asia, where less than half of women have any access to a phone. So that's sort of the big picture here. Just to give you a snapshot of this context, here's the distribution of digital skills. So pink here is what women said they could do. Blue is what men said they could do. And then on the top, you'll see an overall score. So this is out of 14 different skills. We tested 65 in total. So I'm just giving a snapshot of very basic skills to give you a sense of this population. So if I just take this very basic skill at the top, and this was separate questions, we've combined them for simplicity, but do you have the skill of making a phone call or a WhatsApp call? What you see here is that 27% of women can't do that. This is at a population level. So for us here, we might think like that's a pretty basic, like who doesn't know how to make a phone call? So again, this is population-based survey among people 18 to 60 years of age. 27% of people can't do it, right? So when we think about designing programs for these populations, when I hear AI, when I hear lots of like maybe we need to just like calibrate our interests and like, let's meet people where they are, right? And you can look, blocking a number, a key element of security, right? Particularly in India, where people have a fear of being harassed, or being hacked, or, having issues of money and funds stolen, limited skills around being able to block numbers, downloading an app, which is pretty essential for most things, right? So again, I won't go through this, but what you basically see is where people are right now is at a pretty, sort of low baseline, right? Particularly women. Yeah.
Did the survey or the study make any allowances for sort of like, I don't know, design level issues? So like maybe there's UX, UI stuff going on that like maybe the icon for a phone call might look different, or like can they make phone calls over like a those old fashioned phones? Or
I don't have it here, but it tests both observed and reported. And it's on your device. It's not asking you to use my device, which I couldn't use your device, so, and then a lot of effort is into sort of the prompts and the icons and so on. So that is there. That's all picked up during cognitive testing to try and improve the comprehension of the question. So to the extent we could, it is there. So I'm just looking, I'm a little short on time, but the other way we sort of tried to get at, ultimately with this, we were trying to look at, can you have a minimum set of questions that can be used to measure digital inclusion in a easy way? And so you get about this by, obviously a data-driven approach and then an expert-driven approach, which sort of simply put bulletproofs your estimate against criticism that it's so tailored to this one extreme context in rural India, right? And so we basically went through a sort of very rigorous process to come down to a minimum set of 13 questions, which again, half of which are really around digital competency. So it then kind of comes to this question of like, how do you use this? What's the relevance of it? And from a very sort of practical standpoint, the government in Bihar had said to us, like, okay, great. Like you've told us that digital skills is a big problem for women now. And what? Like, we had started this research with them first saying, should we just dump handsets and give everyone handsets? We have money, should we just distribute handsets? And we had said, no, like, please don't do that. Like, it's not going to solve the underlying problem. So what this data in having a more comprehensive set of parameters allowed us to do was show that. So if I look at this digital access and use score, which again includes all of these parameters on digital competency, physical access, safety, security, digital agency, a limited set. And what you can see from the divergence here, blue is men, pink is women. What you see is towards higher levels of digital skills. So move over to the right in this, and you'll see the blue jumps up to the top, the pink comes down. What that in essence is showing a divergence of a gender gap, right? So men, as you particularly, sort of go up in terms of higher levels of digital access and use, there's a more pronounced gender gap. If we split it out, so that we separate out the digital access, which is the physical access to the phone. So that's that question they asked. If I give you a handset, is this problem going to go away? And what you not surprisingly see is actually gets worse. So, you can give out handsets, but it's not going to solve your underlying problem. So in being able to have a separate digital skills score, we're able to show that as one important factor within a series of additional factors that need to be considered when driving digital inclusion. So let me, with 10 minutes left, come to healthcare providers.
2 minutes.
2 minutes, is it? Okay. So let me just move us. So I'll just tell you how we're thinking about. So digital competency at a population level is infinitely more simple. Okay, so for health workers, we situate this process. Obviously, you go through a phase of tool development, implementation, analysis, and use, right? Within this process, competencies are the foundational starting point. So you first have to get agreement on what is the framework, DigComp, a modified version of that you're going to use. Fantastic. We then, need to go through a process of finalizing actually the skills that go within that. And then, cognitive testing ideally, and you finalize a tool, it goes to pilot testing and so on, as is denoted here on the slide. So I just want to tell you briefly how we're thinking about doing this. If I just focus on the tool development part, because that's probably the most complicated, the first thing we do is take the health worker roles and responsibilities. So if I think this is an ASHA worker, a frontline health worker cadre in India, that she has about 6 different roles and responsibilities. Service provision is one of them. So let's just, within that, she's got to do home visits and referral support. Within that, we map the activities, the overall competence she has to have, and the digital competencies within this. It's color coded here to denote the link back to the larger DigComp framework and the competency domain. And then you see within the digital competencies, there are separate skills within this. So it's quite thought out. And then there's a lot of cross-checking depending on the outcomes you want to achieve, to make sure that you've captured the digital skills for assessment. And from that, you come away with a tool. Within that tool, we also test different ways of measuring skills. So it's not just like, can you do this skill? We'll give you a vignette of our scenarios of data and see if you're able to perform a skill in a more sort of approximate way to what we'd expect you to do for service delivery. So that giving you a snapshot of that, I'm not going into the larger issues around how we do the implementation and analysis. Happy to discuss that, later. Just a snapshot of some of the ongoing work in India. So we have digital competency work underway in Meghalaya, which is a state in the north east of India. It's one of the most remote and among the poorest and high mortality areas. Lower population, only 3 million, compared to Bihar, we were at 42 million or something, right? So smaller scale, hilly, remote. It takes me 2 days to get there. And to give you kind of a sense, the idea and the conversation around digital competency is to situate this within a larger recentering of how digital solutions could be improved for frontline health worker cadres and linked to communities. So the idea here for us is not to just think about, okay, should we assess digital competency for the solution, which is often poorly designed now? But if we improve that solution and make it do all the things we want it to do, including AI features and so on, what are the skills that health worker needs to have? So it's, at once sort of meeting them where they are right now, but also imagining a scenario where the solution is better designed for the roles and responsibilities that health worker has. So just noting, this is going to be a cross-sectional survey in 3 districts amongst 5 cadres, and the anticipated use is that it's going to be used for digital upskilling, improved design, and enhancement of existing solutions. So the last thing, I'll close with 3 slides here. The last thing I wanted to sort of signpost is, we often do research because as a researcher, I love research. There's nothing that I wouldn't try to investigate. But from a very practical standpoint, often we get this response of like, okay, yeah, so digital skills are bad. You told me that. And like, what do you want me to do about it? So a very sort of applied, like, okay, you did really robust research. I believe you, but so what? So I think we've tried to increasingly marry the rigor of the research with like, you need applied practical solutions to answer the so what. So we're trying to address that through different reviews in a different to sort of ongoing, consultation workshops and so on. I just want to signpost some of the work that Joff and Innocent are leading with Rebecca. And that is, both sort of 2 separate reviews on measurement, like how we measure, digital competency for key populations. And then in particular, how do we upskill? Like, what are the strategies people have done for upskilling? Is it only done when I'm introducing a new app, or are there standalone upskilling initiatives? Last piece, this constitutes a lot of our thinking, and this is work that Esther, Angelica, and Dr. Loveness are leading, which is around how do you measure harms associated with technology use? So this is population level. And more interesting, which I'm quite excited about, is this work they're doing on how do we measure harms and talk about harms for healthcare providers. So far left here, this is the conceptual framework they're working on, are all the different examples of digital health interventions for health workers. And then we're thinking of potential harms. And we, in essence, just kind of map the pathway, potential impacts. And the work they're doing now is how do you measure this? So that's it. I'll just close. If you want to see more work, you can just check out our website. Here, it's got a lot of stuff on it. And big thanks. Sorry, I ran over time. I'm 1 minute over, I think.
Cool. I'm just good. Thanks so much, Amnesty. I want to try and get it. We've got 10 minutes left for some questions, which is fantastic. Thank you so much. That was a whistle-stop tour of a large number of different things. I do want to just make sure we have a little bit of time to see if anybody, so stop sharing, who's online. Might have some questions, because we've already had a little bits of discussion, but I have to admit I'm still fiddling with the audio here. So we do need someone online to ask a question, so I can at very least find out.
Osama, help me out. Will you add something?
Find out if I can hear you.
We can hear you really well, Angela. Thank you.
I don't think we can hear you.
There's a hand. So Tiki.
The TV's on mute.
Oh no, but I think the audio should be coming to here.
maybe it's on the side.
Thanks, Amnesty and Jill. So I mean, I looked at the. Wait, can you hear me? Hello.
Oh, good.
I
Thanks,
think I
Osama.
can't hear you.
Right.
Hi, can you hear me?
Ziki, do you have a question? So I'm going to play it on my laptop.
Can I go ahead?
Now we have an echo, but we can at least hear somebody.
Maybe they could type the question, right?
Okay, guys, I'm terribly sorry. Given that we only have.
Are there questions in the room, maybe, Jill? Thank you, Eleanor.
All right. Sorry. Okay, sorry. Given that we only have 9 minutes left, I'm going to just ask if those online wouldn't mind typing their questions. I'm terribly sorry about this. We did have an IT support here before we started, but
The room is too fancy.
the
for
room
us.
no, well, there's some problem today. So I'm sorry about that. Since we only have 9 minutes left, and Siki, would you mind typing your question and I'll read it out for Amnesty? In the meantime, I'm going to see if there's a question in the room. Sorry, that's my short-term solution to this crisis.
Thank you so much.
Okay. Anybody in the room have a question? Eleanor.
I was wondering, maybe it's twofold, but if you want to just only answer one half of it. First part was about, I know you said you were going to focus mostly on the skills, and I wanted to give you the opportunity to say a little bit of something about attitudes, and I was prompted by helping my mom with an IT issue last night.
Oh,
And being reminded of how suspicious she is, that not like, that's all she is.
Yeah.
Even though she knows how to do the thing, she's just a bit scared to do it. And then the second one was on the potential thoughts, and then what those are.
So what's interesting, that sort of fear gap. So when we, in India, we measured observed ability to perform certain skills and looked at the overlap with those same skills with your reported. So we started by asking you in a module, like, to do reported first, and then we observed you. And I was so hoping for a fantastic storyline about men over-reporting, how great they were at things, and and none of that was there. And actually the gap between, and they didn't know that observation was coming, right? So, and very surprisingly, there wasn't a big gap between what you are observed to do versus what you tell me you can do. And to the point you just made, surprisingly, people that had never done certain skills could actually figure out how to do it during the observation. So it is a mental block. And I think the question is measuring that mental block best done quantitatively or qualitatively? And we sort of kind of come at it like, we're already asking you so many questions. You're not being paid for the survey. People are fatigued. We need to be very practical about what can be rigorously measured using what. And so what we've tried to then usually do is pair all quantitative surveys with qualitative research. So what I would say is that attitude issue, I would narrow in on people that did not self-report being able to perform a skill, but actually could do it, and sort of be like, well, like what was the thing there? Like, tell me about that. So I would, yeah, I mean, we could look at attitudes. It's not that we can't try to measure it, it's just complicated. And I'm not sure it's worth what you get. We saw that a lot around also social norms, which is a separate lecture in and of itself. Anyway. Yeah.
I'm going to ask a question. So
Tell me.
it's a tough question. So a lot of this, the need for surveys and the Gates Foundation, everybody, it seems to be based on some core assumptions about digital competencies and digital interventions equals development and good health.
It does. There's a straight line, Jill.
But there seems to be this like really solid kind of like no questions being asked about the future of the world resting in the
Digital.
need for improved digitization of these places.
Yeah.
And I know that there's studies about like, you give some
Yeah.
farmers a handheld device and they can order their grain.
No.
effectively and all that kind
The
of thing.
CHW
And
review.
female gender empowerment,
Yeah, no.
with education.
So I
And
would say the evidence
but
on
where-
that isn't there.
we're asking more questions about it, like, or are we just like assuming that like,
Well, I think
Yay,
there's
digital.
there's a question on the thing here that links to this a little bit, which is basically something about funding. Do you have advice, considerations for sustainability? So this links to the funding question. So I would say we've learned, or we are learning a lot from the narrative review that Chinwe and Naomi are leading. And what's been fascinating about that is having conversations with folks that, because most of the studies you pick up in that are 10 years old. So now what? Like what happened? You did something in 2014, 2015. It had some kind of an impact. It was very narrow, but like now where have we been? And the gap between, like, not a lot has happened. Like we were on a qualitative interview with very respected researchers out of Pakistan yesterday who have been involved in digitalization of the frontline health worker cadre, lady health workers. And this, for me, is a health worker cadre that is government funded, very well established. Like it ticks the boxes in terms of health systems readiness to introduce a digital solution. It's not like I have an externally funded NGO siloed intervention over here, but even in that context, they're still not using digital solutions at scale because the study didn't show an impact. So then you ask this question of like, okay, was it the solution that was poorly designed? Or was it the health worker cadre? Like what factors drove that? And I think what we saw in that particular instance is that they narrowed it on one disease health condition that has moderate low prevalence when compared to the N number of other higher leading causes of mortality diseases. And the health workers were happy to have it, the device, but it didn't address the full scope of work. It was a fragmented solution that did 1/100th of what they have to do, and it was implemented without linkages with the upper levels of the health system. So I think, to your point, your larger existential question, I don't think you'll be talking about digital health in 10 years. I think you'll go back to talking about health services delivery and everything's digitized. Or, it's become mainstreamed within it. Like, I don't think it needs to be separated out as a thing. Increasingly, we're moving in the direction where, you'll hopefully get away from fragmentation and siloed solutions towards integrated digitalization versus digitization. And I think the fault of lack of impact has often been poor design.
I suppose that, sorry, go ahead.
No, I can second your point, and I'm more in the sort of the chatbot space, so it's like,
Oh, no.
I understand.
Oh, no.
But my question is also about funding. It's like the reliance on, or like how it's like a history of, especially like Gates Foundation and a lot of these more like philanthropic capitalistic models pushing towards some kind of technological solution. And I'm just curious if that and I know they do a lot of like really cool work and really interesting work around health, but a lot of the times there have been issues with like them sidelining other sort of I remember when I went to a conference in the AI for Africa space, and they were showing these amazing AI glasses that look at the patient, and you're in Ethiopia, and then you call the doctor in Washington who's a specialist.
Oh, don't get me started, yeah.
And it's good, it's great, and it looks fantastic, but like there's so many questions about there's a time difference between Ethiopia and Washington.
I think you come back to, I don't want to get into specific donors and so on. I think what I would say is that you have to have a baseline of health systems readiness before we start talking about digital solutions. So if you don't have a frontline health worker cadre that is paid and, has a clearly sanctioned, clear-cut, approved scope of work, including XYZ, whatever, don't talk to me about digital solutions. Like, if you can't pay your health workers, if you don't have drugs in your clinics or adequate facility, basically the foundations of a health system, we shouldn't be let's first do that first, and then you can talk to me about digital solutions. And there are enough places in the world where the baseline readiness is there, you can focus on that. But, for a whole variety of reasons that, nobody listens to me. I don't know.
There was a question from Tiki about are you talking to community health workers? But I think the idea is that it's all.
Yeah. So we're mostly interested in the bottom of the pyramid. I get less interested when you talk about medical officers, higher level. I'm not worried about them. I really, and this is even the harms work is heavily focused on the story of telling, using data to tell the story of complexity. And I think the burden on digitalization has largely fallen on frontline health worker cadres. It started with simple maternal messaging programs in the last decade. Then the easiest cadre to digitalize was frontline health workers. And, there's been efforts at facility levels to introduce EMRs and so on, but it's, those workers are the ones that aren't paid and are supported the least. And there's often not a pipeline to a proper job for them. And I think, introducing digital solutions in that is a complicated scenario and not necessarily, I don't know. I think we need to pay people first, right?
Yeah. I think we have time for one question or comment. Anybody? Yes.
I guess my it's more of a comment than a question, and it kind of links to what you were saying, Jules, and what you were saying about having that base readiness. Has there been any kind of, I don't know, I'm just thinking about being on the ground in like this rural place in India. Is there any kind of interaction with the workers there about what they need in terms of outside of digital health and their acceptance into those solutions? And is that actually something they want? Is that something that they feel?
Yeah. So like the balance between the digital needs and the general. That's what you were speaking.
Yeah. I mean, listen, like all the research we do obviously tries to put their voice front and center through qualitative and quantitative methods. I think there's been whole decades of research looking at user-centered design. How do you do it? Design with the users, etc. And still the solutions that we are, being asked to support or evaluate in India are, I would consider badly designed, not in a malicious way. It's just a straight line digitization of a paper-based record.
Yes.
It's not thinking like, oh, Jill's a health worker, and actually, what would elevate how she's seen by community members? If we use this decision support tool within it and we gave her a sub list of screening, or we had a workflow plan where she could very clearly see the top 5 priority cases she needs to see today. And that to me is a useful case of digitalization, whereas digitization, so one line paper to thing, that's how the solutions currently are. And so we've said to very senior leadership within different states, like, no, you have to, so I could show a slide here, but where we very clearly mapped out, these are your existing solutions. You need to improve them in these ways. Think about this, and it's not just unique to India. I don't want to put in India, I would argue, is a decade ahead of everyone else in the global South. I mean, it is the reason we like to work there is because it's very, very far advanced compared to where everyone else is. They have 5 cadres of frontline health workers, government funded. The government puts money into their own programs at the dependency on external aid is minute compared to the investment from the government. So, I mean, that's a ready environment to support, not one that has a lot of donor dependency per se, to the same extent that some of our environments elsewhere have, right?
We're going to have to wrap it up. Thank you so much. Thank you to those online. I'm sorry about
Thanks,
the technological challenges that excluded you in parts. But thank you very much. Thank you, Amnesty. That was fantastic. And it was a good taster of lots of other things to come. Thanks. Thanks to those who are here.
Yes, thank you.
And thank you.
Reach out to any of the
I see Osama's put some of the links and things on here. So
thanks.
that's great. Cool. Thank you, everybody.
Thanks.